Hi guys, today I want to talk about lateral hip pain syndrome and the stretches that we can do to alleviate it. This is a problem that most of us will experience throughout our lives, especially as we age. If you have lateral hip pain, you're likely going to have pain over the side of your hip where the bone is close to the skin. This area is called the greater trochanter, which is the upper part of your femur, where the gluteus medius and minimus tendons insert onto bone. If you have this problem, you're probably going to recognize what I'm about to say. I've seen this problem tens of thousands of times, if not more, and patients pretty much sound alike. It's as if they all saw Big Bird and the Cookie Monster rob a bank, and they're all telling me what they witnessed. Most of these patients will say things like, when I stand up from a seated position, especially if I've been sitting for a long period of time, I have pain in that area. Once I am standing, it takes me time to get walking because otherwise I would not be able to do it because I feel like I'll get stuck and have pain in that area. If I'm sitting for a long period of time in a car ride, for example, it's going to really ache on the side of my hip. It's really hard to go up and down the stairs because of pain, and I try to avoid going up and down the stairs or inclines. And probably most annoyingly, patients get woken up all the time by this pain. They try to roll over onto their side and it wakes them up. And as I'll talk about in future videos, sleep is an incredibly important part of healing. It's how our body resolves damage that we incur throughout our day in walking and doing our usual activities. And it's also very important in resolving inflammatory processes. So oftentimes this can promote a vicious circle where patients have this problem for weeks to months, even years, because they can never resolve it because they're not sleeping well. My early experience treating lateral hip pain in the first few years of my practice was very disappointing. I did very typical things that I was taught to do, like inject the hip with steroids. I sent patients to physical therapy for gluteal strengthening, and of course, I prescribed anti-inflammatory medications, which are not sustainable treatments. And these patients kept coming back time and time again with the same problems, and I grew very frustrated because I, as a doctor, didn't have a satisfactory solution for them. After seeing so many patients with this problem and being very unable to help them, I decided that I needed to figure out what was causing this problem. If you look in the internet and look up lateral hip pain, you'll see what I'm talking about. You'll see so many things that are implicated as the cause and so many variable treatments. And when in medicine, if we have like 15 things we can do for a problem, usually we don't understand it well. And that prompted me to really figure out what is going on here and how can I start helping my patients. After I disappointed so many patients with insufficient treatment, I started to try to pay more and more attention to this problem. And I realized that there were commonalities that many of these patients shared. And perhaps the biggest commonality was that all of them had a tight iliotibial band, or IT band. The IT band is a structure that runs from the brim of the pelvis, called the iliac crest, down to this spot on the knee called the tibial tubercle. And I noticed that patients would often have tenderness and pain all along that IT band, especially where it went over the top of a high point, like the greater trochanter, like the lateral knee, and like the tibial tubercle here where it inserted onto bone. And also a lot of patients will have buttock pain, pain right against the sacrum that I think oftentimes is mistaken for SI joint pain, and they'll have pain in the muscle belly as well. And it made me think that if I could do something about that tension, maybe I could have some success treating these patients. And so I started to figure out how to stretch these areas. The gluteus maximus and the tensor fasciae lata are the two muscles that power the IT band. And so when I started to teach patients how to stretch these areas with already known exercises, for the first time in my career, these patients would tell me that their pain went away and they stopped coming back time and time again. Later on, I'll post a video taking a deeper dive into the causes of lateral hip pain, the anatomy in that area, and my clinical experience with this so that you can understand this better. I'm a big fan of patients understanding their problems and how they occur, because most of us will just explain it to patients and tell them what to do, And patients will sometimes take our word for it, but I think that it's really important that you have an understanding as to why you should do certain things. And I don't think that the musculoskeletal system is so complex that we can't individually understand it, regardless of our educational background. I'm directing my own patients to this video after total hip replacement surgery with me, but if you had total hip replacement surgery with another surgeon and you want to check out these exercises yourself, please check in with your orthopedic surgeon first before attempting them. Total hip replacement surgery today is done by a variety of different methods that have their own considerations and own potential risks and precautions that need to be respected. So please check with your orthopedic surgeon first before attempting any of these exercises. After total hip replacement, the condition of the hip is often very similar to patients who are experiencing lateral hip pain, which is why I think I've had significant success in patients improving after total hip replacement while doing these exercises. Before surgery, your hip will likely have been very stiff and you were operating it within a very restricted range of motion, and many of you will have been limping, causing further reinforcement of this problem. Once the mechanical obstruction to motion is relieved in total hip replacement, the situation is very much similar to lateral hip pain patients. Fortunately, so many of my patients have experienced a lot of relief after doing these exercises, and many of them, as well as me, feel a very positive association between doing these stretches and feeling a lot better. I hope you feel the same way, so let's get started. This first stretch is called the figure 4 stretch. Of all the stretches I'll teach you, this stretch probably provides the most return on investment and is the easiest to do because all you need to be doing is sitting down. I would try to find a chair where you can sit with your knees more or less at a 90-degree angle. The goal of this stretch is to start from a position where your ankle is just crossed over your knee to a position where you are crossing your ankle over your knee and leaning forward. You want to arrive at that eventual position slowly, and I certainly don't want you to strain your muscle or cause injury because that will be a setback and certainly not encourage you to come back to the stretch regularly. So take it slow and do it step by step. The way to get started is you're going to want to have the leg that you're not stretching somewhat extended with your heel on the ground. And to start this, you just cross your left ankle or the side that you're trying to stretch over the down leg. And little bit by little bit, you're trying to walk your ankle over your kneecap. And that can be done in phases, just a little bit at a time. And if you have trouble using your hand to reach down because of mobility issues, you can get a therapy belt that you wrap around your ankle and pull on it with your hands. Or you can use a regular belt and just make sure that you pad the belt around your ankle so you don't hurt yourself. But you can just bring it up to where you feel a healthy stretch, but not so much pain, and just hold it for about 20 to 30 seconds. And you can relax, come back to it. You can do it as much as you feel is reasonable, but please don't hurt yourself in this process. Eventually, your goal will be to get your ankle above your kneecap and hold it there. And once you're there, the next phase will be to do small incremental changes in the flexion of your lower leg to eventually get to the point where your tibia is straight up and down, your leg is straight up and down from the ground. Once you can get here, I would recommend that you then sit up straight with good posture. And what that means is you want to raise your chest towards the ceiling, and that's all you really need to think. And you'll feel a stretch in that position, most of you. You'll notice that your knee after surgery or with lateral hip pain will generally be a little bit higher than where mine is. And that's because of the action of the gluteus maximus fibers and the tensor fascia lata. The gluteus maximus, in this position, most of the fibers are going to be in front of your hip, or kind of in this area to exaggerate that. And together with the tensor fascia lata, it's going to be pulling your knee up like this, and it's going to act like a flexor of the hip. So the next phase will be to, in good posture, you want to push that knee slowly down to as horizontal of a position as you can attain. I would, again, do this in phases. You don't have to be here in one session. You want to just kind of do it slowly until you can reach this position. Once you can comfortably reach this position, the next step is going to pretend that your back is connected to your pelvis as if there were a pole or a board making your spine completely one piece with your pelvis. And then what you're going to want to try to do is just incline forward through your hip joints, not through your lower back or not through your upper back. You don't want to hunch over like this. You want to try to move as one piece. And you may not be able to go very far before you really have a significant stretch. So with this, as with the other parts of this stretch, go slowly. And you're just going to want to lean forward and feel that stretch. And once you get to a position that is a bit, maybe 75% of maximum tolerance, just pause there and hold it for about 20 to 30 seconds. And eventually, if you do this all the time, you'll be able to get your back more or less close to your leg. But I have found that in periods where I'm not stretching, I build up tension and this becomes difficult again. So this is why you have to keep coming back to this stretch. From the front, the stretch looks like this. I'm going to put my left ankle of the hip that I'm stretching over my right ankle, and my knee is going to be somewhat as straight as possible. And then I'm going to reach down and try to gently and slowly pull my ankle up. And I'll stop whenever the stretch is something like 75% of your maximum tolerance and just hold it there. Again, if you have trouble doing this with your hand, you can certainly have someone attach a belt or a therapy belt around your ankle, and you can just pull up the ankle a little bit at a time. And eventually your goal is going to be to get that ankle above your kneecap. Once you're above your kneecap, you can start to gently and slowly bend the down leg to a goal of getting that leg straight up and down with the ground. Once you're in this position, sit up straight, and that means raise your chest towards the ceiling. Next step is going to be trying to incrementally bring your knee to a more horizontal position and hold it. Once you've mastered that, chest up, spine fused, and just bend over a little bit at a time to enhance that stretch. This is how to use a therapy belt or a yoga strap to help get your ankle above your knee in an easier way. You'll start by putting the ankle over your opposite ankle, and you're going to just slowly raise your ankle up your lower leg. This may be enough of a stretch for you, so you would just hold this in the position of reasonable stretch for 20 to 30 seconds. And eventually, you should be able to bring your ankle above the knee. There are other variations of this stretch that you may be familiar with or may have seen. One is called the leg cradle, where you basically do a bicep curl with your leg. I don't really do this stretch very much because I find it kind of awkward and energy consuming, but it may be something that you'd like to try. Another variation of this stretch is a yoga position called thread the needle. To do this, you'll take the ankle of the side you're stretching and put it over the knee, and then you're going to use your hands to flex the other hip so that you're coming more and more into a externally rotated figure four position. So this is something that might be more comfortable to many of you once you are able to get to this position. This next stretch is my personal favorite. This is a very advanced stretch that requires enough flexibility and balance to do, but I like it because it is an easy way for me to get a long stretch because I can hold the position for a bit longer than the other methods. You're just going to need a countertop, and you want to check to make sure your wife is not watching you put your foot and your knee on top of that countertop. And all you got to do is lean over and put your elbows down and look at your phone and watch YouTube or whatever you want to do. But I can't overemphasize, please don't try to start with this stretch. This is something that requires you to get to the point where you can put your leg in this position comfortably. And I would do that through doing the other few stretches that I've shown you. And if you can't do this stretch at all, don't worry about it. Just use the figure four stretch in the seated position. The next stretch we'll be going over is called the standing TFL stretch. TFL is the abbreviation for the muscle here in the front that does attach to the IT band, called the tensor fascia lata. In order to do this stretch, you're going to want to find a door frame that you can use to stabilize yourself with your opposite hand from the side you're stretching. To get started with the stretch, all you have to do is take your right ankle and cross it over the left ankle, which is the side I'll be stretching in this demonstration. Your goal in this stretch is to form the letter C with your left hand and through your hip and down through your lower leg on the side you're stretching. And I hope you can see that. And me using my hand up here, this is not because I fancy myself a ballerina. It's really helping your trunk move into this position. Many of you, of course, are going to be tight, and this is why you're doing the stretch. So don't expect to just be here. You're going to want to just move to a position that's comfortable to you and in which you're getting a reasonable stretch. Over time, your goal is to get into the maximal position. To enhance this stretch, you can cross over even more and really crank that stretch all the way into a letter C like this. And these stretches you should hold for about 20 to 30 seconds longer if it's not bothering you. As seen from the side, this is what this stretch looks like. In this case, I'm stretching my right side, so my left hand is holding on to the door frame, and I'm going to cross my left ankle over my right side. And it's really important not to be flexed over when you're doing this stretch. That's really diverting the stretch somewhere else. You want to be straight up and down, or even a little bit extended through the waist. You're going to take your right arm and put it in the air, and then you're going to, in this case, I'm going to be pointing my hip towards the camera and going into a C position. Again, that C position from the front looks like this. These next few stretches are stretches aimed at stretching the hip flexor muscles and the quadricep muscles as they run in front of the hip. And having groin pain and groin tenderness in both situations of lateral hip pain as well as after hip replacement are very common, and they have to do with tension due to recruitment of these muscles and also the muscle's tendency to impinge or rub against things. In the case of the hip flexor, it goes over the pubic bone, and if it's tight, it'll be abrading against the pubic bone. There are also two heads of the quadricep muscle called the rectus femoris that cross the hip joint, and when those are tight, they can be painful as well. So I'm going to show you how to stretch these structures. This first stretch is a standing hip flexor stretch, and it is aimed at stretching the psoas complex, which is the muscle that runs in front of your hip and helps you in activities of hip flexion. But it also is playing a major role in your gait cycle. The muscle runs from the back of your spine as well as the inside part of your inner table of your pelvis and hooks into your upper femur in a place called the lesser trochanter. And we'll go over that in an upcoming video. To get started with this stretch, you're going to step forward with the side that you're not trying to stretch, in this case my right, and you're going to allow that knee to bend. The back leg that you're stretching, you want that knee to be locked out straight during the entire duration of the stretch. What you're going to do is put your hands on your waist and lean backwards. And just doing that little bit of a lean, you're probably going to feel engagement of the groin, and you don't want to overdo it. So just go to a position that's comfortable. And what I'm doing is leaning back and I'm pushing my pelvis forward with my hands. I'm going to show it to you from the side so you can see some other details. But basically you'll stretch in this position and hold it for 30 seconds or so. I think it's really important that you see this stretch from the side. You're going to want to find a wall that you can sidle up to, because many of us lose our sense of balance over time as we age, and I want you to be safe and not fall over. In this demonstration, I'll be stretching my right side so you can see a little bit better, and I'm right up against the wall. I have my left elbow touching the wall so that I can steady myself. So again, I'll step back on the right side and step forward on the left side. Your front leg will be slightly bent. And again, you'll put your hands on the back of your waist, stand up straight, elbow against the wall to steady yourself, push your pelvis forward and lean back. And I'll hold this stretch for about 30 seconds. To enhance the stretch, you can step back even farther and keep your legs even more separate. Again, lock that back knee and lean back. And you should feel engagement in the groin where you're getting that stretch. This next stretch is a prone hip flexor and rectus femoris stretch. The rectus femoris is one of the quadricep muscles, and it's unique in that it crosses not just your knee joint, but your hip joint as well. And so in order to stretch this muscle, you have to extend your hip at the same time as you're flexing your knee. I'm going to show you various ways of doing it. I think this is probably the safest and most accessible method for most people. You're going to want to lie preferably on the floor, but you can use your bed as well. And you're going to want to get something to boost your knee up so that you're extending your hip. In this case, I'm using a sandbag, but you can use a stack of towels or folded up blankets, and it may help to tape the blankets together with some masking tape so they don't shift around, and just put it on your bed or put it on your yoga mat like this. I'm going to start by showing you how to do this with a strap because it can be hard to reach over and grab your foot. So you're going to put yourself prone and you're going to place your knee on whatever you have to raise your hip. And you can see in this position that my hip is extended because I have it boosted up. I'm going to grab the strap and bend my knee. And you want to lie flat, and you'll feel that stretch in the front as you bend your knee with this strap. Alternatively, if you're flexible enough, just reach over, grab your knee, and gently pull it forward. And hold that stretch for about 30 seconds, and stop. You don't want to be too over-exuberant with the stretch because you can strain your quadriceps. So please do this incrementally and don't generate an awful lot of pain whenever you're doing it. This next stretch is going to utilize the wall to help stretch the rectus femoris and the rest of the hip flexors. This is an advanced stretch that requires a certain level of flexibility and balance control. And please avoid this stretch if you don't have faith that you can do this safely. And what you'll need is a wall and a yoga mat against the corner of the room. And you'll start that by going into the all fours position. And then next, you're going to take the side that you're stretching, the knee of that side, and put it into the corner of the room. And then you're going to want to put the back of your foot against the wall. And then the next step is to move your foot in front of you where it's about 90 degrees, where your leg is 90 degrees to the floor. And I think it helps to kind of bring your foot externally rotated for balance. And your goal here is to slowly rise up your trunk like this into a position where you can stretch your hip flexor and your rectus femoris. And over time, you're going to want to slowly get to a position where you can get more and more flexibility through this stretch. It's very easy to strain your quad in particular by doing this, so please don't push this hard. Please don't bounce. You're just going to make small incremental movements towards this position. As seen from the side, the wall stretch looks like this. You're going on all fours, knee to the corner of the room, the back of my foot on the wall, and then I'm going to march my other foot into a vertical position with the ground, and I'm going to slowly push myself up into a position of stretch. Hold it there, and again over time, you're going to want to aim to get to a more vertical position and hold that. So there they are. Those are the stretches that I use to help my patients recover from lateral hip pain, as well as for recovery after total hip replacement. If I am not your surgeon who has done your hip replacement, please check in with your orthopedic surgeon to see if these are appropriate for you. There are many different approaches to hip replacement, and the last thing I want to do is cause a disruption of the repair that your surgeon performed or cause you to dislocate your hip. You absolutely need to check in with your orthopedic surgeon to make sure that these are reasonable for you. And if you have any questions for me and you're one of my patients, please reach out to me as I've shown you how to do. I'd love for you to leave questions or comments in the comment section below so I know where I've been unclear, and this will help me in future videos that I'm going to release for the benefit of my own patients as well as the broader community. I hope you get as much out of this as my patients have. Have a great one.